Good morning! If you have decided to study and you want to become a professional hypnotherapist, keep watching our training videos about clinical hypnosis. Hypnotherapy is an effective technique with which you can help and improve the quality of life of a great number of your future patients. Remember, read the description of this video where you can find a link to free training classes on clinical hypnosis, and also you can download several ebooks also free. The information in this video is extracted from our book Direct Clinical Hypnosis, Deep Hypnosis, of our publisher Clinical Hypnotherapy, registered with ISBN. Direct Clinical Hypnosis, Self-Instructions, Examples for Tobacco and Anxiety, Part 1. Self-Instructions, Mickenbaum, 1977, aimed at implement rational, adequate ideas and verbalizations for adaptive copying. According to this author, it's more effective to pronounce the self-instructions aloud than to read them out loud. Self-instructions are the emission of a series of stimulating messages which consist of giving oneself the necessary instructions to enable the accomplishment or coupled with a given task, situation or event. This can be generated by the patient or provided by the therapist, guided self-instructions. The aim of training in self-instructions is that the patient learns to establish concrete and correct self-verbalizations about specific situations, tasks or coping events, Self-instructions guide behavior, especially in new and complicated situations or tasks. The objective of self-instructions would be to arrive and adequately direct the person's internal dialogue, so that it helps him or her to cope with new and complicated situations or tasks. They are used to break down an activity or problem into a series of steps, where each self-instruction is a step to solve a situation or activity. Learning. To give effective self-instructions is a good way to reduce anxiety, and in this way to be able to perform or face a certain task, situation or event in a more relaxed and calmer way. We must teach our patients to give themselves self-instructions to reinforce the hypnoid treatment that we apply. In this way, the patient learns to talk to himself or herself in order to provide him or herself with the correct guidelines for the resolution of tasks. With this, the patient can face a certain task, situation, or event with greater success, thereby increasing their self-esteem and self-control. By means of training in self-instructions, the aim is to reduce the internal monologues of a defeatist and, above all, negative character that patients have, such as, "I'm not capable," "it is not worth trying," "I always fail," "I'm not going to succeed," "I'm weak," "I'm going to fall back into the vice of smoking," "I'm going to fall back into the world of cocaine," "I'm always eating," "I can't control it," etc. For positive self-instructions that guide towards action and coping with a given situation, "It's worth trying," "It's not easy for me, but I'll keep trying," "Next time it will be better," "I'm not a smoker," "I have stopped using," "I'm strong," "I'm very brave," "I will succeed," "Will is power." These self-instructions can be given by the patient or by us, the therapists, either under hypnosis or in the form of guided self-instructions. We must teach our patients to change their negative and inadequate self-instructions for other positive and more adequate ones. One of the most effective techniques of the cognitive behavioral approach has been the use of self-instructions for the management of different behavioral manifestations. We'll now look at different types of self-instructions. Patients should have these instructions at home, in their room, in their wallet, etc. They have to have them at hand for when they need them. For example, to counteract a crisis. The crisis situation will depend a lot on the resources that the patient has to overcome it. Self-instructions are one more resource on which the patient can rely. This type of exercise is very important for hypnoid therapy, as it helps the therapy to be much more effective. They are exercises that the patient must practice on their own, tertiary exercises. Do not confuse the concrete moment, the desire to smoke, with the consequences that entail that decision of only smoking a cigarette. You will pay a very high price. There is not one single cigarette that is false. So, stop fooling yourself and face reality. If you smoke just one cigarette, you will fall back into the cycle of addiction and all that goes with it. The self-instructions for smoking are a guide to help the patient and prevent them from falling back into addiction. Self-instructions for anxiety. 1. Detect. You have detected your emotions and you have high anxiety. 2. Stop. Stop the thought that has led you to this anxiety. 3. What's wrong with me? Define the problem. 4. Goals. You must lower the emotion and calm down. 5. What can I do? Look for alternatives and do not fall into despair. You can also do this other way. 1. I detect that I'm getting anxious. 2. Stop, 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 stop. Calm down. 3. What's wrong with me? I have anxiety and this makes me exaggerate everything, what is happening to me and any problem I have. Anxiety amplifies everything negative. 4. What can I do? Cut or lower the anxiety. 5. How? I can use the paper bag technique. I can also use the 10,000 technique. I can also do a quick relaxation. I take a deep breath, hold the air for a few seconds, tense the muscles of the body, slowly release the air, and at the same time, tense the muscles of the body. If you're interested in learning more about clinical hypnosis, watch our next video, Direct Clinical Hypnosis, Self-Instructions, Examples for Cocaine and Alcohol, Part 2. Remember, with the description of this video, you can find a link to free training classes on clinical hypnosis, and also you can download self-free ebooks. If you have any questions, add them in the comment area. On this topic and many others we'll talk about in the channel and in the videos that we'll publish. So, if you're interested, do not miss our next videos. Thank you very much.